Hi, this is Dr. Germ from ID. Someone paged me.
This is Dr. Guy and don't know. Is this ID?
Yes, I represent the entire world of ID and I don't have a name. How can I help you?
There is a patient here who is 6 days post C-section. She was febrile post-op and has come back to the ER 2 times since she was discharged. I was called by the lab as her blood cultures are positive for Proteus and Enterococcus. Her C-section wound is red and weeping. She has a temperature of 103 and an elevated white blood cell count. I think these blood cultures represent contamination.
Really? So, 2 positive blood cultures in a patient with a fever and either a wound infection and/or endometritis post C-section is nothing to be concerned about. Where the fuck did you train? University of Malpracticus gonna happy gasp.
Well, if you think we need to treat her. But, tell me why she was not so sick when she first came in. All patients with bacteremia are really sick.
Well, she was sick or she wouldn't have come into the ER twice. 30-year-olds can hold their own until they crash and burn and are in the ICU. Aren't you going to treat her with some antibiotics?
Well, if you think so, yeah, let's give her AMP, Gent, Fagel and Vonco.
She had Proteus and Enterococcus that are both sensitive to AMP, so let's stick with one drug and not give this poor lady C. diff. We can place a PICC line to make the infusion as easy as possible.
She can't get a PICC line as she is hypercoagulable post-delivery.
Now the RNs can't get an IV into this patient. They are asking me what to do for access as the OB-GYN call schedule is apparently some exercise in obfuscation and it's always easier to reach our department as we actually answer our pages. You said no PICC, so now what for access?
Well, let's give the patient oral ampicillin. She will do okay.
No fucking way. She has a bacteremia with 2 different organisms and oral amp is not equivalent to IV. You are playing with fire.
She'll be fine.
See you at the deposition.